Welcome to the OptiHealth Revolution seminar. Thank you for joining us. What is the OptiHealth Revolution? The OptiHealth Revolution is a proposal for a paradigm shift in healthcare, a change of focus from illness to wellness, for living longer and better for less. The big question is, how? Let me explain with a hypothetical situation. We all know binge drinking is harmful in a variety of ways. But is harm reduction the best approach to solve this problem? If the short-term effects of binge drinking, confusion, poor coordination, irritability, slurred speech, could be reversed immediately by taking a pill, so that normal function could be resumed immediately, would this be a good thing? Could this harm reduction approach reduce some of the acute problems, drunk driving, violence, crime, injuries? Yes, it could. But would this approach also increase some of the chronic problems, addiction, unemployment, poverty, depression, organ failure, death? Yes, it would. So what is the conclusion of this hypothetical situation in real life? Making something that is bad, less bad, in the short term, ends up making it more bad, worse, in the long term. By removing the short-term effects, the consequences of binge drinking, the need to take personal responsibility is also removed, which then increases the unhealthy behavior. Here is the simple formula. Irresponsible drinking plus anti-irresponsibility pills equals a ticking time bomb. We all know this to be true. Galatians 6:7 tells us, "Be not deceived, God is not mocked. For whatsoever a man soweth, that shall he also reap." Knowing this to be true, let us consider, if removing the need to take personal responsibility increases binge drinking, how might removing personal responsibility affect other unhealthy lifestyle choices, such as unhealthy eating habits? Should medication be used to lower cholesterol in order to eat high-fat foods? Or low energy levels? Should medication be used to lower blood pressure in order to avoid exercise? Or poor coping skills? Should medication be used to lower anxiety in order to ignore high stress? This approach is not sustainable. We eat, we take a pill. We sit, we take a pill. We stress, we take another pill. This so-called harm reduction approach leads to a condition known as polypharmacy syndrome. Medication should not be used to make unhealthy lifestyles less bad, because medicating unhealthy lifestyles only makes them less bad in the short term, and making unhealthy lifestyles less bad in the short term only makes them more bad, worse, in the long term. So what are the clinical and societal outcomes of such an approach? I can assure you, things do not end well. Medicating unhealthy lifestyles increases lifestyle diseases. In fact, treating lifestyle diseases now makes up over 80% of our nation's healthcare costs, without significantly extending life expectancy, and without significantly improving quality of life. Is this just a matter of healthcare mismanagement on a national level that needs to be corrected? Or is there a personal issue here that needs to be considered as well? John 10:10 tells us, "The thief, Satan, comes not but for to steal and to kill and to destroy. I, Jesus Christ, am come that they, believers, might have life, and that they might have it more abundantly." We know Satan destroys, and we know that only God can restore. The question is, do your daily lifestyle choices side with Satan in destruction, or with Christ in restoration? So what are our healthcare choices? Should healthcare treat our unhealthy lifestyles, or should healthcare help us change our lifestyles in order to prevent chronic and costly lifestyle diseases? Treat or prevent? The answer seems obvious, but how can we know for sure? If our healthcare system made a paradigm shift from treatment to prevention, how much of a difference would it make? The following graphs are compilations of results from health and medical studies over the past 60 years. This graph shows the lifeline for an unhealthy lifestyle in terms of wellness, quality of life, over time, quantity of life. With an unhealthy lifestyle, you are at increased risk for disease, and your life expectancy is only 63 years. This graph shows the benefit of medical intervention regarding lifestyle-related health risks and diseases. This extra 12 years of life is the miracle of modern medicine. It has raised life expectancy from 63 to 75 years. But at what cost, and for what quality of life? This graph shows the benefit of disease self-management for older people who have chronic lifestyle-related diseases. With disease self-management, patients learn how to take better care of themselves. This not only adds 7 more years for a life expectancy of 82, it also adds more life to those years. This graph shows the benefit of risk reduction for middle-aged people who have lifestyle risks, such as smoking and obesity. Risk reduction adds 14 years for a life expectancy of 89 and makes the second half of life much more productive and enjoyable. This graph shows the benefit of personal health promotion for younger people who choose a healthier lifestyle. With health promotion, a life expectancy of 96 years and beyond is achievable. Impossible? Is living longer and better with lower medical costs only a theory supported by research? Or can this be our reality? It's a reality. We have proof. Consider the Blue Zone. A Blue Zone is a community where people commonly live more than 100 years. They're called centenarians. There are only 5 of these spots on planet Earth, and only one of those 5 spots is in the United States. Loma Linda, California. Research on these centenarians has clearly shown that their remarkable longevity and happiness is because there is a level 1 trauma mega hospital across the street? No, it's because of their healthy lifestyle. If you want to learn more, you can read the National Geographic article by Dan Buettner, An American Blue Zone, the Longevity Oasis in Southern California. A free downloadable PDF of the article is linked below. These centenarians accomplished in one spot what needs to be accomplished nationwide. This is the goal of the OptiHealth network. So how can we accomplish this paradigm shift from unhealthy to healthy lifestyles for all Americans? We assert this paradigm shift can only be done through a healthcare revolution from the bottom up by creating a culture of optimal health, not by mandating it nationally through the Department of Health and Human Services or the Centers for Disease Control, but individually, voluntarily, one person at a time. We believe this will require a 3-pronged process, which has already begun. Number 1, we assist the elderly for better self-management of their chronic lifestyle-related diseases. Number 2, we identify health risks and coach middle-aged people in therapeutic lifestyle change. And number 3, we encourage everyone, especially young people, to develop and maintain a culture of health promotion and wellness. Healthier, more active lifestyles throughout the lifespan. So, what does a healthy lifestyle involve? It's basically the opposite of an unhealthy lifestyle. Instead of poor eating habits, we develop healthy eating habits. Instead of low energy levels, we exercise to maintain high energy levels. Instead of poor coping skills, we develop effective coping skills. More specifically, we get daily physical activity, regular exercise. We get lots of fresh air and sunlight. We drink plenty of water. We get adequate sleep and relaxation. We eat a whole food, plant-predominant diet. And research also confirms that a healthy lifestyle includes trust in God. Even though lifestyle change is simply a matter of choice, old habits can be hard to break. That's why we are building a network of OptiHealth volunteers and professionals to help you make the best choices for yourself. OptiHealth choices, day by day, week by week, and year by year. So here is the challenge. Knowing the low cost and high return of a healthy lifestyle, are you willing to make therapeutic lifestyle changes in order to achieve and maintain your optimal health? If you are satisfied with the crisis-driven, expert-directed, high-cost system, you can keep the old paradigm of illness. Or, if you are interested in our goal-driven, self-directed, low-cost system, you can choose the new paradigm of wellness. Your healthcare, illness or wellness, is your choice. We encourage you to make OptiHealth choices. We can help. We are revolutionizing healthcare, and we hope you choose to join us. There are no membership fees, no products to buy, and no schedules to follow. Just better choices for therapeutic lifestyle change, for optimal health, for the joys of life. Get started on your OptiHealth revolution today.